I'm Emily Walker, MedPage Today. Being a medical student doesn't exactly leave a lot of free time for things like happy hours, working out, eating balanced meals, or lobbying Congress to lower the cost of medical school and malpractice insurance. But about 300 student members of the American Medical Association took time out of their hectic schedules to come to Washington this week and let lawmakers know what they see as the major barriers on the road to becoming physicians. Paul Mayer, a second-year medical student at the Medical College of Georgia, spoke with MedPage Today after he met with his representative, Dr. Paul Brown, a Republican and former primary care physician.
I would say the two most pertinent issues to medical students for right now will be the rising cost of medical education. It's becoming a serious problem. Students aren't able to choose the career options that they want because their debt has gotten to the point where they can't afford to do specialties such as primary care, family medicine, obstetrics, peds. It's just really difficult for students to go into those fields based on the amount of debt that they graduate with.
Laura Gephart, who recently finished her third year of medical school at Loma University Medical Center in California, agreed.
That we need to decrease the cost of medical student education. It's prohibitive. It decreases diversity, and it also burdens us with loans. The average loan that a student needs to repay in the United States is $155,000. I'm from California, and the average just for my school is $167,000.
Gephart said she carries about $250,000 of debt. Mayer said he plans on graduating with about $120,000 of debt, less than many of his fellow students because he's attending school on a partial scholarship. While he might have less debt than some students, financial realities are leading Mayer to consider switching from his planned field of obstetrics and gynecology to a field in which he doesn't have to devote so much of his pay to buying malpractice insurance. Or at least, Mayer said he'll consider practicing in a region where malpractice insurance is cheaper.
Well, I've looked at different places around the country as far as where I might practice obstetrics and gynecology, and one of the places that I looked at was South Florida, Miami-Dade County area, and I just, in checking up on malpractice rates in the different parts of the country, I know Dade County averages $260,000 a year in malpractice that an OB would have to pay. It's hard to imagine making enough money to cover just that, and then as well having a mortgage and different costs of living. I can't even fathom paying that amount of money. Oh, it'll definitely influence where I practice, and ultimately it may influence my decision. Like I said, I'm still a second-year medical student, so I haven't really been able to see all of the different specialties in medicine, and so I'm definitely open to other options in medicine, and a lot of my decision right now to sway me away from obstetrics would be the lifestyle. It's just, I don't know if it's going to be worth it in my lifetime to deal with the problems that are facing that specialty in medicine.
Gephart, who is eyeing primary care, said she's certain she wants to be either a family physician or an obstetrician gynecologist, but she won't deny the lure of some of the more lucrative specialties.
You can't ignore the fact that when a medical student looks at the difference between primary care and being an orthopedic hand surgeon, you're looking at a difference of $300,000 or more per year, and you can't say that that's not tempting. I think I'm still going to go with primary care, but
Mayer said many of his fellow students entered medical school with hopes of working in primary care, but have since switched directions.
I've noticed over the last year and a half of being in medical school, students kind of evolve as they move along and start to become more knowledgeable about the careers that they're seeing, and they're interviewing doctors and shadowing doctors, and they're starting to understand how difficult it is to practice primary care in this country. And I know a lot of my colleagues are really moving towards those specialties now in order to pay back a lot of their student loans, and they just don't think it's feasible to open up a practice, especially fresh out of medical school, with that much debt. So I've definitely noticed many of my colleagues switching career options. We've had the opportunity to interact with primary care physicians, and it's just an overwhelming sentiment that they're struggling. They're struggling to keep their practice going, what with the Medicare reimbursement and a lot of issues that they're having. Especially in the state of Georgia, only 15 counties have adequate medical care. The rest are considered underserved, and most of that population are going to fall under the Medicare, Medicaid type of patient, and doctors are starting to limit their numbers as far as those new patients just because the reimbursement is so low. So I think as we move along in our career, we're starting to become more educated about what it means to practice medicine in this country, and it's getting really difficult.
The reality of payment issues in malpractice insurance isn't a total shock for these students. They've heard of these problems for years now. But coming face to face with the reality that payment might actually affect which field they choose to enter has been a hard pill to swallow, explained Kari-Claudia Allen, a student at Boston University School of Medicine.
It wasn't a huge shock factor because you've heard the talk, there's a lot of buzz around it, but having to make that decision for yourself, it's a different feeling. You know, you always think about, I want to be a healer, I want to go into this for the right reason, and you know that you'll be taken care of in the end because of the doctor's salary, but now it's kind of like, that's the question, you know, that there's a question there too of whether that's going to be insensitive at all.
All three students said they would also like to see an increase in the number of Medicare-funded residency programs available. I'm Emily Walker, MedPage Today.